Great. Thank you very much for the invitation to give this talk today about our efforts to support patients with neurological needs in war-stricken Ukraine, focusing on increasing access to anti-seizure medication as well as other neurology medications and supporting rehabilitation of patients with traumatic brain injury as well as limb amputations. As you all know, next week will mark the one-year anniversary of the war in Ukraine with really no end in sight to the fighting and the suffering, which is why it's so important to continue our support for these patients and local healthcare providers. Today, I am joined by a remarkable group of individuals who have dedicated countless hours to these efforts, and it's a true honor to introduce everyone. First, I want to introduce Dr. Olha Tchkiewska from St. Nicholas, Lviv City Children's Hospital. Then Svetlana Faktorovich, neurologist from Florida, from Boca Raton Regional Hospital, Dr. Christina Briscoe-Abath from Boston Children's Hospital, and Aziz Samad, the CEO of Brothers Brother Foundation. First, I want to take a moment to acknowledge the Ukrainian patients and their families who continue to endure great suffering and whose perseverance inspires our work every single day. I want to also acknowledge the Ukrainian neurologists, including those who have lost their lives in the war. And lastly, I want to acknowledge the Ukrainian Neurology Initiative, which is comprised of multiple individuals. I won't ever name everyone because I probably will miss some people, but it's been a true honor working alongside every single one of you. I also want to highlight, I just realized the slides are not moving. So the introductions. I also want to highlight that our efforts are possible largely because of the ongoing support from our local and international neurology community, as well as non-for-profit partners and our home institutions, including Brothers Brother Foundation, who's a non-for-profit organization that's been instrumental in funding the aid and coordinating complex war zone logistics. I want to acknowledge Boca Raton Regional Hospital, the largest supplier of anti-seizure medications for the outpatient population in Ukraine. I want to acknowledge my own institution, Boston Children's Hospital, and here thank Dr. Pomeroy and Dr. Pearl for their leadership and continued support of our efforts. And many, many others who have contributed to this effort, including industry partners who have made generous donations to our cause. Our outreach was met by an incredible response from all of these organizations, and we are truly, truly grateful. There are also large organizations, professional organizations contributing to our effort, including the International League Against Epilepsy and the ILE chapter of it, the American Academy of Neurology, Women's Neurology Group, Roe Foundation, and countless other organizations, as well as countless individuals who have dedicated their time and effort to help our cause. So to give you a quick background, as we all know, almost a year ago on February 24th in 2022, Russia invaded Ukraine, and since the initial days, we continue to witness ongoing violence and inhumane acts against the free and courageous people of Ukraine. The war and displacement quickly created many unanticipated needs, including access to medications, which placed people with epilepsy at risk for serious injury and death. As the atrocities of war unfolded, the international community and individual citizens sprang into action to help Ukrainians. Relatively quickly, numerous NGOs and governmental agencies started working on critical access to food, shelter, medical supplies, medications, and other essential items. However, anti-seizure medications were not prioritized, as it often happens in the time of conflict or a natural disaster. And this is what motivated us as neurology and epilepsy providers to focus our energy on increasing access to care and medications for this vulnerable patient population with neurologic diseases, which are not always prioritized, as I mentioned, during these times. So first, I would like to ask Dr. Olha Tyczkiewska to join us. Olha, thank you so much for being here today from Lviv. We particularly appreciate it, as we know how busy you have been working in the hospital and volunteering for various organizations. So we truly appreciate your presence. We feel lucky as we know that internet and electricity are not always available in Ukraine. So we want to welcome you warmly first, and then we hope to get your insight also on the situation in Ukraine. So maybe if you could start by telling us about how the war affected neurology patients during the first months of war, and why you decided to reach out to colleagues in the US and Canada.
Yeah, well, thank you, Agnes, and thank you, Felix, for finding time, to dedicate this discussion to war in Ukraine and this situation, we are living with every day so far, with the big hope, that the moment will come when freedom and peace will come to our land again. As you were actually, giving a little bit of a story, about how the war started and everything, it actually brought me back with my reminiscence to the moment, a very emotional moment, very painful moment, when we woke up one morning and heard about, the Russian invasion of part of Ukraine. Lots of emotions, lots of pain, despair. Those were probably the first feelings, that all of us heard, maybe not quite understanding what is the first and correct thing to do, whether to go to the hospital, and maybe, being useful there, or maybe, take care of your own family and make sure your own kids, are in a safe place. Yeah, so I still remember, the emotions of that morning. This was lasting not very long, because, after that, the first call from the hospital came saying that you have to be there, making sure that all stable patients, should be going home, and we have to make sure that they will have enough places to accept people like wounded and injured people, and so just who will be fleeing from war from the prefrontal regions. I mean, probably day 2. This was the day when I started getting first calls, as well as my colleagues, part of, I know some of the colleagues are present here today, from patients asking, like, Dr. Olha, I remember still the justifications of the patients when they were saying, oh, we didn't know that the war will come to our house. That's why we don't have enough drugs. We didn't, if we knew, we would prepare ourselves. We would make sure, we have enough for a certain amount of time. But, some of the parents would say, oh, we just have drugs for like another 3 or 4 days, and we cannot find the, drugs to buy in a pharmacy earlier. Maybe you know the way, where to get them. And I remember on day 2, I was still running after work, trying to gather, the medication essential for soldiers and for military people, and, just to be able to send to the front line. But at that time, I realized, oh, there is another issue coming. We are running in a deficit with anti-seizure drugs. And when I started actually going from pharmacy to pharmacy, realizing that the drugs are not there, probably the first families, who ran quickly to the pharmacies, bought whatever was left on the shelves, and then, nothing left else, for others. And I understand, okay, we don't have enough in our hospital pharmacy. And then I asked, I was trying to contact different pharmaceutical representatives, asking, do you know, are you going to deliver more? And the question was, we don't know. And then, another issue that men or fathers not go abroad anymore to bring drugs from there, because, this was also one way to do that. But because, all of a sudden the war started and the men were not allowed to go. And this was really a desperate moment. I remember myself crying, for a couple of, minutes or hours, because I realized, you can be a doctor, you know how to help, but, you don't have to help us. And then, and I started imagining all these kids coming with uncontrolled seizures, to the hospitals. And this is the moment when you feel so helpless. I started calling my colleagues in Lviv and then in Kyiv as well, and just asking, if they have any ideas of how we can help our patients. And I realized that everyone was pretty much in the same condition. And that at that moment, this was really an emotional step. You know, I just sat down and quickly drafted a letter, and I decided to send to whoever I know, because I just came 6 months, 9 months, 6 months before I just returned from Canada, where I did my fellowship in epilepsy and neurophysiology. And I decided, okay, you know, whoever is in my list of emails, I'll just spread this letter, hoping that maybe there will be some kind of an idea and advice, you know, from colleagues. Maybe someone will reply to that. At the same moment, I know that Dr. Piotr Zwolinski, who is probably present today as well from Poland, was already contacting our colleagues in Kyiv, asking what help do we need. And thank you very much to you colleagues, because I know how quickly you responded to our call for help. I didn't expect that to happen, but I will be always grateful for your response and for all of help that you are providing till now.
Yeah, thanks so much, Olha. And what an incredible story. And you know, we're always here to help, as you know. And maybe Chris, can you tell us about how Olha's initial call to action resulted in the formation of this neurology grassroots efforts? What happened with this letter that Olha is describing, and what are the things that resulted from that?
Yeah, so I remember when we first, so Eris, who unfortunately could not be present today, had trained with Olha at Sick Kids. And so she had sent this letter to him. And I remember the moment when he forwarded this to us and said, hey, we have to do something. And all three of us, Eris, Agnes, and I got together in Agnes's kitchen, where we subsequently spent many hours together, trying to figure out what can we do. You know, I don't think that anything had really prepared us to try to confront or act on something in a situation like this. So we decided that the first thing to do was to let people know about what was going on, because we hadn't heard that this was a problem anywhere. And obviously this was very early on, just about 2 weeks into the war. And so we posted everywhere, you know, on Twitter, on all the social media, and the Women in Neurology group in particular, which became a very powerful outpouring of support from that group. And, you know, there were so many people that wanted to help. And then the question became, how, as neurologists, can we do anything? How can we help to get the medications and funds, or medications and funds to these patients? And so, Agnes, I know you had been reaching out to your connections in Poland, where you're from, and Neurosphere, and everything was happening very fast. We also were speaking to organizations like the ILAE, and made the seizure response guide in crisis, which Alina was instrumental in translating into Ukrainian with the Yes ILAE section. And so everyone was just very interested to help, and really wanted to. But as we were thinking about, like, how do we get medications and buy seizure medications, I think that that's where Svetlana came in. So I'll let her continue the story.
Great, that's a great segue. So Svetlana, you've been a powerhouse behind this operation in many ways. Can you tell us about how you initially became involved in the procurement and the distribution of the medications, as well as the initial challenges related to the process?
Yeah, so thank you everybody so much for being here. And Agnes, thank you so much for having me. So basically, you know, I'm originally from Kyiv. I grew up in the United States. And so when the war started, I was really having a hard time kind of coping and coming to terms with what was going on back in Ukraine. And so I remember, you know, I was scrolling through Facebook, Women's Neurology group, and I saw Dr. Tchikivska's letter, actually. And at that moment, I was like, I think I can help. So it kind of gave me like a purpose for it gave me my purpose in this conflict. And so the first thing I did is I started raising money just myself through Venmo. And then I realized financially that probably wasn't a great idea tax-wise. And so I decided, you know, me and my friend, we decided, you know what, we're going to approach my hospital. And so I went to my hospital foundation and I asked them to open up a nonprofit fund for me to raise money. Initially for medications, I didn't know how I was going to buy them. And step by step, they agreed to open up the fund. And it took a little bit of logistical work, but essentially they figured out how I can essentially purchase very large amounts of medications directly through the pharmacy and through their distributor at wholesale pricing. And I started raising money through a special fund that they built through their hospital foundation. And so that kind of took care of part of the process, but then the issue was shipping. So I wasn't sure, what meds were needed. I did reach out, I did get into contact, with Chris and Oila, and then the question was, how do we get it there? And initially I was shipping myself through DHL, smaller shipments. Shipping was very expensive and it was difficult. And then things started getting stuck in customs. And I was reaching out to multiple humanitarian organizations, asking them, listen, can I work with you? I have the funding. I will send you the medications. Can you distribute them? And I came across a couple of roadblocks. The first one was that a lot of the larger, really established humanitarian organizations were actually uncomfortable shipping medication, including medications that really are not controlled. For example, Keppra. Keppra, we think of something being pretty benign. Well, I had multiple organizations tell me that they were not willing to ship it because technically it was a gray zone when it comes to shipping medications into the European Union. So that was one roadblock. The next was finding an organization willing to actually send the medications to where they're needed, which meant to Oila, to the neurologists in Ukraine, because majority of those organizations were shipping only to the Ministry of Health, and they had no other interest in shipping any other way. And it was really a blessing for all of us to meet and decide, we're going to work on this together as neurologists. And then really the game changer was when we met, Ozzy and the Brothers Brother Foundation, because that kind of put everything into place and it put the pieces together. And not only did we have a way to purchase the medication exactly how much we wanted based on the current needs of the patients that the Ukrainian League Against Epilepsy, had a list of, so they could tell us exactly how much of every medication they need, what they don't need. We had a method to purchase the medication, which was through the Boca Raton Regional Hospital. And now we had a way to ship it. And so we worked together with the Brothers Brother Foundation. We ship medications early on in multiple ways to determine what is the fastest route, what is the most reliable route, and we were able to perfect essentially the shipment method. And so since then, it's been actually very smooth and easy to get done beginning to end. And it's been, it was a process, but it's been pretty incredible figuring out how to do it.
Great, that's wonderful. Ozzy, you and your organizations have been instrumental in, helping us, successfully not only procure the medications, but also deliver them into a war zone region. Could you tell us a little bit first about Brothers Brother Foundation and its mission, and how you learned about our initiative and how Brothers Brother Foundation became involved?
Yeah, certainly, Agnes. First of all, thank you to everybody for having me also. Just as a quick background, Brothers Brother works in 4 different areas, which is healthcare, infrastructure, disaster response, and education. And we do this in 2 ways. One is by supplying needed, it could be pharmaceuticals, medical supplies, humanitarian supplies to areas of need. And the other is to support programs that are on the ground. In terms of our response and collaboration, which I cannot say enough about everyone on this panel and how really exciting and productive it's been to work with everybody in this response. Initially, I actually got an email from Danielle Friedman, who works with Dr. Harvey Levy, and just asking about what we had done. So what happened originally right after the invasion, we reached out to some of our partners locally. We're based in Pittsburgh to see what medicines and supplies we could provide. We had needs from the Ministry of Health, list of needs, and mostly it was related to wound care and so on. We were fortunate, we got large donation of about 5 truckloads that we actually got, we shipped over, went from here to Paris to Poland to Lviv. Ironically, Olha was the day that Lviv first got missiled on March 17th. I happened to have gone to St. Patrick's High School, so I remember the day well. But so we were fortunate to have gotten the supplies and a first set of supplies in. And when I received the email, essentially they were asking, what have you done, and are you able to do more? So again, I couldn't say enough about the relationship. Subsequent to that, we had calls with Chris, Agnes, and Svetlana, and Danielle also, in terms of whether or not we could get meds into Olha, which was, the main question. In memory serving, Svetlana had mentioned that some of the medicines she had sent previously had essentially been caught up with customs in Poland. So we did a couple of test shipments, and fortunately everything worked out at the end of the day, and we were able to send meds to Olha along with some supplies on an ongoing basis. And I just want to add that, in terms of the acquisition, what everyone on this call, especially Svetlana, on the last few donations, which have been pharma related, but also humanitarian related. I mean, it's really been key how everyone's participated. And on Ola's end, being able to further distribute even beyond her own hospital in Lviv has been key to the success of the program. So again, from our perspective, I think it's very effective. As a matter of fact, I would argue one of the most effective programs we have ever run in our 65-year history. So thank you to everybody on the call.
That's wonderful to hear, and thanks everyone for sharing our story of how we initially got to know each other, really launched this very robust response in the time of need. Now, let's talk about how the situation has and our efforts have evolved since the early 2022. I can tell you a little bit about our organizational structure now. So we as a group, we meet on monthly basis. We used to meet much more often, sometimes twice a week, then weekly, then every other week. And now we have a pretty well-oiled mechanism of delivering these medications. So we meet less frequently, typically, but also on ad hoc basis, we can meet at any time, really to address the changing needs. We're also in nearly daily communication via email or WhatsApp or other ways as well. Now, maybe Olha, back to you. Can you tell us what is the current situation with access to anti-seizure medications, both in the hospitals as well as in the outpatient setting? Where are the patients getting the medications from? Are these medications affordable to the patients and their families? And what are additional challenges related to that?
Yeah, thank you, Agnes, for this question. I guess the first 3 months probably were the hardest, because this was probably the period of a great shock where everyone was trying to figure out, what is the correct way to go and to do. And at that time, also our pharmacies were trying to find their way, how to organize, their work and deliveries of essential drugs. As it was mentioned already by Svetlana, we were trying also to find a way to get drugs from the Ministry of Health. Because we knew that some of them were shipped there, but unfortunately, because they were not the priorities, they were kind of lost in the warehouses. And simultaneously, we were getting already up to 3,000 requests from the families, about the needing anti-seizure medication. So I guess it was probably closer to the summertime when pharmacies, at least on those territories that were attacked more rarely, started already working and maybe bringing supplies. So we can already count, at least on having, on those supplies in the pharmacies of the families who could afford and who didn't have any financial issues at that time, at least could go and buy some of the drugs there. But again, it was about like part of Ukraine, right? That was maybe less under attacks. But there was still an issue, and this issue still exists in prefront line regions, because we like still majority of the families that are at least in our registry are really dependent on us, because, you know, of permanent bombing and attacks. Unfortunately, even if pharmacists work there, they usually have the supply of like commonly used drugs, but definitely again, anti-seizure drugs are not the drugs that are, you know, easily found there. So we still get this request from the families all the time, you know, asking to send them like monthly supply, 2-month supply, 3-month supply. We also found out that families who stayed on the temporarily occupied territories have even like a very huge issue in finding the anti-seizure medication that they need. You know, unfortunately, we are not very, very successful with organizing shipment of drugs there, because we had a case where one of our volunteers was killed, unfortunately, when trying, you know, to get drugs to Children's Hospital, to pediatric hospital in Kherson, which is now already, you know, deoccupied. I mean, we also had several cases of deaths, you know, from status epilepticus, and 2 of them actually that we had were reported to us by the families was actually because of the lack of carbamazepine, you know, like a very commonly used drug, which was very unfortunate. And then, you know, unfortunately, for example, I have these 5 families right now in Zaporizhia region, and I'm still looking for the ways to deliver drugs to them. There were like already maybe six times they were trying, like different types of volunteers were trying, you know, to bring the drugs through, but a couple of times they were just thrown away, you know, by the, you know, Russian soldiers will not allow the drugs to go, even though we were trying to explain this is for children, this is not for military support, this is, you know, so we are still dealing with this issue there. Also, unfortunately, some of our pharmaceutical factories, you know, they were, you know, destroyed by Russians, and that is why even those drugs that were registered and we didn't have a need in supply, we have a lack right now. Like, for example, like clonazepam, let's say, right? I mean, the drug, the old drug, right? But I mean, we really do have a deficit of this drug right now. Not enough supply, like in our pharmacies. And again, you know, unfortunately, we also feel still like we have actually a full dependency on the drugs that parents were getting from abroad. Because again, majority of the families, it's actually a big, huge issue for them to go abroad for drugs. A lot of families have their fathers or brothers, you know, or sometimes those parents are fighting, you know, or involved in military operations. So it's impossible for another family member just to go abroad and to get a drug from there. That is why, again, these families are dependent on us. And of course, the last issue is that a lot of families are struggling with financial issues, you know, so sometimes we get these letters, yes, there are drugs in the pharmacies, but, you know, unfortunately, I don't have enough money to buy them, you know, so people can ask, you know, about like food, drugs, and other essential needs. So I would say definitely overall the situation is better, because as I mentioned, you know, a lot of pharmacies are reopened, majority of the pharmacies are reopened on territories that are not occupied. I mean, and we still have an access to the drugs. The families have access to the drugs that are registered. But I mean, unfortunately, there are still a lot of families whom I mentioned that are dependent on our efforts. That is why volunteer like drivers who are really brave people are the heroes, you know, who go even to the most, like, you know, heaviest parts of where the heavy fights are taking place and where still people stay because of the different reasons they were not evacuated from there, and they actually deliver drugs to them. Sometimes they go even to houses of people, you know, trying to deliver drugs for them. We also work through Nova Poshta, which is like a quick way of sending drugs to families. We used to try to work through the hospitals, but it's actually harder because to count the doctors from the regional hospital who spread the drugs, you know, among families who live in that specific region is also hard, because the logistics there can also be, you know, I mean, impossible or very hard to organize due to war. That is why we keep a contact, even though this is very time consuming, this is really hard, but we try to actually ask for help from physicians, doctors, residents, and contact every single family. You know, once in 2 months or once in 3 months, we do that to check if the needs are there, if they're still in Ukraine, and then, you know, organize shipment. And then, you know, we can also have a feedback that the drugs arrived and, you know, they actually get what they asked for.
That's wonderful, Alha. And from our perspective, I think it's been incredibly helpful that you guys have been able to keep the registry in a way of patients with epilepsy, like locally and regionally, and then letting us know also on an ongoing basis sort of what medications are running low so that we can quickly address the needs as they come along. So thanks so much for doing that.
Yeah, I mean, I have to admit that, of course, you know, 3,000 families, I mean, 3,000 and few hundred families, this is definitely not even close, you know, to the actual number of patients who are struggling with epilepsy. But, you know, even if you reach them, we feel already a little bit better. And of course, we know that probably a lot of families are now being abroad, and as we understand the situation with supplies, you know, is better there. So they at least have access to physicians and to drugs. Yeah.
Great. Now, Svetlana, back to you. So in addition to helping with anti-seizure medications, you've been very involved with other initiatives as well. Can you tell us more about those?
Yes, absolutely. Actually, Agnes, just one more other thing I do want to mention about the medications. You know, in addition to purchasing from Boca Regional, you know, there were some medications, controlled medications, that we really had a lot of time, we spent a lot of time and effort trying to purchase that really are very difficult to purchase, especially in the United States. And so in the process of figuring out exactly how to make this project run, exactly how to appropriately distribute the medication, get it into the hands of Olya and her colleagues, and then distribute it to patients themselves, we were very lucky to get in contact with the Israeli government and Sarel, which is a nonprofit branch of the Israeli government. And so essentially, one of the hardest medications that we had, that we really, really struggled to get, was vigabatrin, which, to be fair, we still continue struggling to get it. But after multiple countries told us they unfortunately could not sell it to us, including pharmaceutical companies, including CEOs of our pharmaceutical companies, actually the Israeli government sold us 3 months worth of medication to cover the 103 children in Ukraine that were registered as being on vigabatrin for infantile spasms and other refractory forms of epilepsy. And so that also speaks, though, to how effective and how remarkable this project has been, because in a country of 40 million people, I'm sorry, or more than 40 million people, we were able to get these drugs into the hands of 103 children in Ukraine registered as being on vigabatrin. And luckily, they sold us 3 months worth of medication. We were able to, Olya and her colleagues were able to distribute it to those patients. And obviously, at this point, we're now looking for additional ways to purchase it. But nonetheless, I did want to just mention how incredible the Israeli government was in that effort.
Lana, I thank so much for making that point. And I think it can't be overstated how important that international collaboration has been. And I want to highlight a couple other partners. I think Neurosphere has been a wonderful partner. You know, it came in very early on and continues to help us well. So thank you to Dr. Zwolinski, who's participating also in this talk as well. Additionally, purchasing medications from other countries like Germany, India, right? Those are all key pieces that also help us do the work that we do. So thanks for making that point. All right, now can you tell us more about other initiatives that you kind of spearheaded?
So one of the other things that has come up is that a lot of hospitals are really in need of EEG machines for evaluating patients. And so, there was one clinic where unfortunately we lost two neurologists, and they had an out-of-date epilepsy machine from it was a Natus EEG machine from, I think, the 90s, as well as multiple hospitals that were in really really big need of a brand new machine. And so as it turns out, honestly, there's a lot of companies out there that want to help and they don't know how. And so it's been great finding out that those companies exist and working in collaboration with them. So I was very lucky to work with Natus. As you know, Natus is the biggest producer of EEG machines and EMG machines, at least in the United States, maybe worldwide. And so we worked with them and were able to purchase 5 brand new EEG machines with video capability and continuous EEG monitoring capabilities that have already been received by the Brothers Brother Foundation and will soon be shipped to those hospitals. And we were able to purchase them at a really significantly discounted price, which has been really amazing. So that's something else we were able to help with. And hopefully those machines will be in the hands of epileptologists very soon. So that's one thing. Another thing is, well, yes, we've been doing a lot of other things, including sending emergency medical kits, CAT tourniquets. We're currently sending pelvic tourniquets, which we were able to purchase at a really amazing discount from the North American Rescue, which is kind of the gold standard company that produces these emergency medical equipment. But back to kind of neurology, you know, another project that I helped start was basically focusing on the critical need for prosthetics in Ukraine. So unfortunately, limb loss is a public health crisis in Ukraine, both for the military as well as for civilians. I think the last number that I came across was maybe 5,000 soldiers and 5,000 civilians, all of which have lost limbs. Up until this war, the capabilities of Ukraine to provide prosthetics has been quite limited. And they've honestly, you know, there have been some prosthetic clinics that haven't really been up to date in terms of the modern equipment, but also they've never really needed to be. There was never that much of a need for prostheses in Ukraine. And so that became very apparent after this war, especially because we know that in this war, unfortunately, civilians are often the targets of the invaders. And so, you know, knowing that and knowing the fact that there's actually a lot of people, not only that have limb amputations, but have really complicated proximal limb amputations. And that includes, you know, hemipelvicectomies, you know, and other kind of proximal amputations of the arms and legs. And so essentially, I started kind of reaching out to different organizations and companies, and we were able to partner up with some really amazing companies, including MCOP, Medical Center Orthotics and Prosthetics. They're a prosthetic company in Washington, D.C. that was contracted with the Department of Defense and Walter Reed Medical Center for 20 years. And so we're working with them to provide free prosthetics for soldiers that specifically have complicated amputations that would not be able to get care in Ukraine. So for example, there's 2 guys you see in this picture. So the second one from the left, as well as the second one from the right. So both of them have proximal amputations. One of them has a hemipelvicectomy. The other one has 2 transfemoral amputations. And both of these men were turned down by 5 or 6 countries before BBF came across them. And so essentially, we were able to bring them into the United States and provide them free prosthetics that otherwise would have never been available to them in Ukraine. And so at this point in time, we're working with MCOP, we're working with the Hanger Clinic, as well as Revived Soldiers of Ukraine, which is a nonprofit organization that's been rescuing injured Ukrainian soldiers since 2014. And together we've been working to bring injured soldiers into the United States for prosthetics and rehabilitation. Obviously, long-term, our hope is to find a more sustainable solution within Ukraine, but for the time being, we're helping as many people as we can in the United States. And so these are some of the guys that were able to come with us. And then one other piece of information I wanted to provide is we've also been working with Revived Soldiers of Ukraine on neurorehabilitation equipment. So they run a free rehab center that focuses on neurological injury, including traumatic brain injury, traumatic spinal cord injury. They have a rehab center outside of Kyiv known as Next Step Ukraine in Irpin, and they're building a second one. And so amazingly, with with Ozzy and the money that we were able to raise with BBF, we were able to purchase for them special equipments, including robotic assisted equipment and virtual reality equipment to help with upper extremity rehabilitation that I'm sure a lot of people on this panel are aware of in the setting of stroke. Well, those same types of that same type of technology can be used in neurorehabilitation. And so we were able to provide that as well.
That's such incredible work. Ozzy, Brothers Foundation has been instrumental in making all this work possible, and we truly appreciate it. We are effectively delivering medications, supplies, equipment to a war zone region. This can't be inexpensive. As we think about the future conflicts or natural disasters and the unanticipated needs that they create, we wonder about how expensive it is to provide this type of help. Would you be able to share with us the amounts raised and the costs of aid delivered to date?
Yes, certainly. In terms of the cash amount raised, we've raised approximately 3.4 million, somewhere in that range. And in terms of what's actually been provided, and this could be, different medical equipment, supplies, and whatnot, the total is, we're in process right now of looking at another another machine for to address cancer, advanced cancer issues. So it would be roughly in the $4.5 million, $5 billion range. In terms of some of the work that everyone on this panel has been doing in neurology specific, we have about 700,000 right now that's been allocated, out of which we've spent roughly 550,000, I should say, or so. Most of the pharmaceuticals, as Svetlana was explaining, were purchased through Boca Raton Regional, through some of the other aspects that were mentioned, whether it be through Israel, through Poland, Germany, and so on and so forth. So I think in terms of a response to a situation of this sort, this is really a very interesting case study as to the impact and what it takes to have an impact in terms of the funding, but I would also add on the logistics side across the board. Be it what OLHA has been able to do. I mean, we were fortunate, to connect to a number of different groups. Someone Svetlana just connected us with recently, actually helped us ship 88 pallets that were a donation, also through a connection that she raised from backcountry, which included things like sleeping bags and so on. So not necessarily directly neurology related, but it's just the response itself. It's like a snowball effect. When people see that you're doing something successfully, they're happy to help in any which way. So I think the impact of the neurology response really is much broader than neurology. As I was mentioning, the mobile X-ray machine is, an example. The surgical instruments we've sent in dental supplies, and the other cancer machine. We've also purchased an immunoassay machine for the Children's Hospital. I believe it was in Kharkiv just recently. So again, I couldn't say enough about an efficient, well-run program and the broader impact of that program across the board.
Thanks so much, Ozzy. So maybe as we're trying to wrap up and allow some time for questions and conversation, maybe we can just briefly go around and talk about lessons learned, acknowledging the past and the present, but also planning for the future and like dreaming out loud, essentially, what we think could be an effective response. So maybe Olha, will start with you again.
Well, thank you, Agnes, again. I guess my personal lesson that I learned that, it is okay to ask for help, because I had an issue with that in the past, to be honest, but in this case, I was brave enough, and I'm so happy that I did, right? Because I have to be honest, I didn't expect this type of response. I'm so grateful that, colleagues in Ukraine supported, especially other Ukrainian League Against Epilepsy, the head Dr. WNFO and the secretary Dr. Hapatonov, and so grateful, that colleagues from, of course, European countries, which we still work with, understand and then support us. But, I'm really grateful to you colleagues that not everyone actually knew us personally, but you responded and you trusted us and you believed, in our needs, in what the situation is here. And, I remember what actually would bring tears to my eyes sometimes if I would be maybe too busy, maybe not very well organized to send, and to update the needs, you would actually message me and ask, what are the current needs? Like, how we may help. Just want to make sure that we will be in time. Thank you for that. Really, I truly believe that the teamwork, can do, nothing is impossible. If great people are gathering for a great goal. And yeah, just thank you really for being here. I hope we can, pay back somehow. I don't know how, but without all your support, we would not be able to go through this. And this is not, I'm not exaggerating, because really the situation was really desperate. And only because of this help, we were able to feel ourselves still physicians who are actually helping children. Otherwise, it would be a very severe depression, I would say. So thank you again.
I think I'm speaking for all of us, not only here on the panel, but also for the larger neurology community. It is like a true pleasure to be able to help in any way we can and continue to support you guys for as long as needed. So Svetlana, how about you? What are some things that come to mind?
I think that as physicians, I think in navigating the difficult healthcare system of the United States sometimes makes us feel powerless. And I don't know about everyone else on this panel, but I know that there are times where I'm at work and I feel like I have no power in what I do and helping people. And the truth is, I think that everybody has a lot more power than they think they do. And sometimes it means meeting the right partners and meeting the right people. But I think that if you guys are interested in a cause and you're willing to put the work into it and find the right people to help make it happen, I think your potential is unlimited. And so I never imagined that I would be able to be a part of a project like this. And it's been pretty mind-blowing that I have. And it's because of the amazing people that I'm working with, the amazing people on this panel and people that couldn't be here today. But nonetheless, I think that everyone's potential, I think your potential is unlimited, and when it comes to global health, I think you'd be surprised how many people want to help, but don't know how to help. And you just have to meet them and give them an opportunity. And that includes companies and organizations that if you're willing to go out there, put yourself out there and ask for somebody and ask people if they're interested in whatever your interest is, you'd be surprised how many people want to be a part of it.
That's wonderful. Totally agree. I think if you have a goal, a common goal, and you really want to achieve it, there are certainly ways, if not already existing, then ways that can be created. Chris, how about...
Agnes, maybe sorry for interruption, but I was going actually to mention, and 2 weeks ago, I received a call from a soldier, and probably this could be the only conclusion that I could make from our conversation, but this was the father of 2 kids who are suffering and struggling with epilepsy, and he called me to tell thank you for taking care of his kids, and he told me thank you really for doing that. Now I can actually do my duty, and I can be, at least not anxious about my family, and I can just concentrate on defending my country and fighting. So this is probably this was really emotional to me, to acknowledge all the work that is being done, by this great team of people. Yeah.
Certainly. Thanks, Olha, for sharing this powerful story. And Chris, how about you? What are some things that come to mind?
Yeah, I think echoing off of what Svetlana has said and Olha has said, for me, it's all been about the power of relationships. none of this would have been possible if we hadn't known Olga on a personal basis. And I think as people shipping seizure medications initially out of UPS into a different country, having the confidence that there's someone on the other side that's been able to get those medications to the kids and the families that need them. And in some ways, we're trying with the earthquake in Syria and Lebanon and Turkey, we're trying to find if we can have some of those similar relationships in country where we can feel like we can confidently be able to figure out the logistics and be confident about how those medications will get distributed. So I think it's been a lot about the lessons of the power of those relationships and relationships with everyone on this panel, who we all know each other very well from many Zoom calls, even if we haven't met that many times in person.
Thanks so much, Chris. And like you said, I think building powerful relationships is quite impressive, and taking that approach to future needs, right, in other regions, other countries, other natural disasters, I think can be a key to a very dynamic and robust and effective response. And Ozzy, how about you? What are some of the lessons learned for you?
I'll go back to what Chris just said in terms of relationships. I think the key, and interestingly, even on the Turkey response, I actually went back to the person we originally spoke to at the U.S. Embassy in Ankara, Turkey. So that relationship. Also, one of the main things, normally you would assume that in certain normal circumstances, you could just go to the Ministry of Health, for instance, and have them distribute and so on. But in extenuating circumstances, the grassroots, just the logistics through the grassroots relationships that were developed, I think were key to this response and other responses going forward. The other thing I do want to mention, that the amount of support across the board has been amazing. Even I don't know if Svetlana mentioned or not, but the ILAE is helping fund the EEGs that she's procuring, so which is phenomenal. And then from our perspective, it's been amazing to work with a group of dedicated, in this case, neurologists. Honestly, I'm not sure if I knew a neurologist, and my mother happens to be a doctor prior to this, and now I feel like I know the a vast majority of the neurologist community I'm getting to know, which I'm very happy about. And not to mention that Svetlana, Chris, and Agnes are on BBF's board now, so we're very, very thrilled about that. And thank you to all of you for your willingness to serve. So Ola will sooner or later draft you into, but I think you're slightly preoccupied at this point. But in any case, so I think it really comes back to relationships, and I just see this as the beginning, quite honestly, of this. We've been talking about how to replicate some of the work done here in Turkey and elsewhere, and expand everything we're doing. So I think it just comes back to people and your dedication and motivation to doing things.
Great, wonderful. Thank you all for sharing these amazing experiences, and most importantly for the countless hours of work that you all put into this effort of supporting our neurology patients.